My name is Joanna Cohn. I'm the director of the Institute for Global Tobacco Control here at the Johns Hopkins Bloomberg School of Public Health. And it's my pleasure to introduce today's speaker for our Innovations in Tobacco Control seminar. So we're lucky to have Dr. Justin Byron here today. He's currently an assistant professor at the University of North Carolina School of Medicine, but he is one of our own. Justin did his master's degree here and his doctoral degree here, and for his doctoral work actually did a study in Indonesia. So the work that he's going to be presenting today is not that work. It's work he's done more recently. But I wanted to point out that Justin knows Indonesia very well. He's lived there for a number of months, and so he's very well placed to talk about this topic. I also wanted to say that Justin is doing a lot of interesting work. He's done a lot of more recent research on the public's perceptions of danger in the chemical dangers from chemicals in cigarettes. He's looked at perceptions about very low nicotine cigarettes, which the FDA has indicated that they're going to move forward with. So, trying to, what do people understand and where maybe their misperceptions may be and how we can help dispel misperceptions. He's also done work around organic and additive-free cigarettes. So, a lot of interest in how people perceive tobacco products and how we can best inform people about these products. And this project that Justin will be talking about today, takes a slightly different take, but also an extremely important area in tobacco control. So we're always very interested in taxes as a way to reduce consumption and use of tobacco products. And Justin's asking a very interesting question about whether when you increase taxes on e-cigarettes, are consumers looking for substitute products, and maybe we're pushing them back to using cigarettes, a more harmful product. So let's hear what you have to say. Thanks for being here, Justin.
Thank you, Joanna. It's great to be back. It's fun to be back to my old school. I was reflecting on the flight up here that it's actually been about 12 years since I first came here to learn about public health. And it's great to be back and to share things from the other side. I don't think I've ever been in this room itself, but it's a beautiful space and it's fun to be back. So I'd like to share some of our findings from Indonesia. Again, looking at that important research question of if we raise e-cigarette prices, does that increase consumption of conventional cigarettes? I'm going to talk about our methods using Facebook and Instagram for recruiting, which I think was a really innovative part about this, and then some of our findings and some of the ways we had to adapt to changing information that we had. So first, my disclosures. This was funded by a grant from the Institute for Global Tobacco Control here at Johns Hopkins with money from the Bloomberg initiative. I have no conflicts of interest to disclose, and these are preliminary results. So as many of you probably know by now, e-cigarettes are battery-powered devices that deliver an aerosol of propylene glycol, glycerin, nicotine, and flavoring. That's the gist of it. There's some variation in those. Currently in the world, there's about 40 million e-cigarette users, roughly 10 million in the US, maybe 7 million in China, maybe another 5 or so million in the UK, and then spread throughout the world. This is in proportion to about a billion conventional cigarette users. So it's a commonly used product, but still much smaller in scale than conventional cigarette use. And as you can see on the screen here, I show a little bit, almost in chronological order, of the wide diversity of products. There are so many thousands of different products, thousands and tens of thousands of flavors. It's a really diverse product. From the very left, you can see the first ones came out looking like regular cigarettes, the same size. Then they got into the mods, some of the different devices now with the Juul and other nicotine salt devices. It's been quite an evolution. And if there's a common trend to this evolution, it's that they're getting much better at delivering nicotine in a more condensed format. So it's important to think about tobacco products on a continuum of harm. This is something the US government's not especially good at communicating, but scientifically, there is some kind of continuum of harm. It's always hard to know exactly where things fall on this, exactly how much harm, how to put things in equivalent measures. But this was one group of scientists' perspective on the approximate relative harm of different products. And so there's a couple of things to note here, right? On the far left, clearly, let me try this mouse here, right? So I have this laser pointer, virtual laser pointer. Clearly, the best thing is to use no tobacco products if you can. That has no harm at all in terms of tobacco outcomes. Next, less harm would be nicotine replacement products. These are basically medical products regulated by the FDA in the US that are very low harm, have been very well tested. Then you have smokeless tobacco. E-cigarettes are somewhere here in the middle. And over on the far right, we have combusted cigarettes, traditional cigarettes. So one of the fundamental problems in the global epidemic of tobacco use is that, unfortunately, of those billion or so tobacco users, the vast majority are using the most harmful possible way of getting nicotine. And so if people do make a shift from combustible cigarettes to e-cigarettes, it's likely a dramatic reduction in their harm. You have the recent news about the unfortunate acute events related to e-cigarettes. Some of that may be related to THC and vitamin E, but there's also some other long-going studies looking at cardiac possible outcomes, pulmonary outcomes. So let's say conservatively that potentially e-cigarettes do have a mid-level of harm. It's still likely a better move to go from conventional cigarettes to e-cigarettes. Again, clearly the best thing is to use no tobacco products. What we're looking at today especially is, do some people go and shift from e-cigarettes to combustible cigarettes? And people that are using a little bit of both worlds, what's their ratio, and does that change as the price of these products change? And that's what we're focusing on today, is this red arrow. So e-cigarettes first came out roughly 12 years ago in the US, maybe a little bit earlier in China. And over that time, again, they've exploded worldwide, and countries have taken very different approaches to dealing with them. Now about 28 countries regulate them with taxes. 28 countries ban them outright. 13 countries regulate them with taxes. 45 countries regulate them with some kind of measures. And some countries, such as England, are very much on the forefront of saying that, like the National Health Service in England's website explicitly promotes e-cigarettes as a way to quit smoking. So again, there's a lot of different approaches countries have taken, between outright banning them to promoting them as a smoking cessation method. And the US currently right now, I guess I would say, is somewhere in that regulatory group, but in a very, very slow-moving way, unfortunately. So in Indonesia, for a while, up until about 2018, there was basically no regulation of e-cigarettes. And then I'll talk about the taxes that come up. So an important question, essentially from an economic standpoint, is, are these products substitutes? Are they directly replacements for each other, especially economically when the price of one changes versus the other? When e-cigarettes first came out, again, they looked like regular cigarettes. They were about the size of a cigarette, same colors. The ends would light up red like a cigarette would, and they would make a so-called vapor. It's actually an aerosol that looked like cigarette smoke. So they were really trying to be the digital replacement for so-called analog cigarettes. And economics research does show in a lot of studies that increasing cigarette prices does seem to increase use of e-cigarettes. So we know that that direction is probably taking place. And depending on the study, they find that a 10% increase in the price of combustible cigarettes raises e-cigarette use by between 0 and 30%. It depends on a number of factors. The opposite relationship is much less studied. And again, that's looking at whether changing e-cigarette prices drives people to use combustible cigarettes. Indonesia's 2018 tax presented a unique opportunity, and this really caught our attention because of the size of that tax. A 57% tax we thought we'd really see some effects with. In terms of how to measure the effects of one product on another, one of the challenges with the e-cigarette situation, e-cigarettes compared to combustible cigarettes, is the size of the markets. So again, globally, right, we have 40 million e-cigarette users, 1 billion smokers. So about 25 times as many smokers as e-cigarette users. And so this is just, without numbers, just sort of showing the scale difference, right, on the left there. So suppose a third of e-cigarette users quit using e-cigarettes and they switched over to cigarettes, right? So this blue mark here goes down by a third. If all those people move to combustible cigarettes, you actually wouldn't necessarily even see it because of the difference in scale, right? And you have noise. And so if you went to try to look at this question by looking at annual sales, you wouldn't necessarily see the difference. There's also the reality that depending on the country, it may or may not be easy to get good national sales data. In the US, there's no clear, uniform way of getting e-cigarette sales data because you have online sales, you have the big tobacco company sales, you have all sorts of independent vendors. Indonesia is even more so because the big tobacco companies don't have a strong presence in e-cigarettes. And so it's probably thousands of different vendors, and there's really no national data looking at sales. So between the lack of data and the scale size, that's not a very effective approach for looking at this question. So what we did, which was somewhat innovative, I think, is looking at this question from the perspective of the people that are involved. So we looked for a sample of people that were dual users, so people that were using both e-cigarettes and combustible cigarettes, and we looked at their behavior change. We took the people that we thought would be most likely to shift from one direction to the other, and we focused on that little group. So if they were on this chart, it'd be kind of a purple color, they're in the blue and also somewhat in the red. A little bit of big picture background in Indonesia before I get more into our study. It's a very large country, 264 million people spread across 6,000 islands. In terms of smoking, 2/3 of men smoke in Indonesia. It's the highest male smoking rate in the world. And this is very much a gender associated activity where only 3% of women smoke. Most of the cigarettes smoked are clove cigarettes called kretek, and they cost about $1 or $2 a pack. 15% of all deaths in Indonesia are caused by smoking-related causes. If you're curious, in the US, I looked it up, and it's actually about 17% right now of current deaths in the US that are related to smoking. So kind of comparable there, but realistically, that's probably going to increase a lot in Indonesia as people get older. The e-cigarette prevalence in Indonesia is not very well studied right now. Hopefully, we'll get some data in a year or two. But currently, I would estimate somewhere around 1 or 2% prevalence. And again, to give a reference in the US, it's somewhere between 3 and 5%. And geographically, Indonesia is located just north of Australia and south of Malaysia. So again, sort of some background information. These are some World Health Organization rankings and ratings on the different sort of fundamental tobacco control policies. I converted them to a letter scale here. So monitoring-wise, looking at the prevalence of tobacco use, Indonesia is pretty well. They have some pretty good nationally representative surveys. In terms of warnings, they do have warnings on the packs like this one. There are some problems with it. They're not the most effective visual warnings, and the tax stamps actually cover up the warning a lot. But they're certainly better off than the US, where we still don't have any warnings yet. They offer some smoking cessation services. Taxes-wise, I would say at the time we did our study in 2018, maybe they'd be like a C rating on taxes. They're actually getting pretty good now at progressively increasing those taxes. They don't have very strong smoke-free policies, especially at the national scale right now, but there is some work going on citywide in different cities. And advertising-wise, they do not have very strong restrictions on marketing and sales and basically marketing, promotion, and sponsorship of tobacco products among the public. And I'll show some more of that. So here's just a basic picture of Indonesia. It's a gorgeous country. I've spent some time there, and nice tropical climate. It has its modern elements. Here's a picture of modern Jakarta. It also has a large part of the population that's not especially modern. This was a picture I took in Bogor. It shows a couple of kids waiting for one of the city buses. I think the girl there is probably in a school uniform. And you can see above their heads that Dejarum Super MLD, it actually says the word mild. That's a cigarette brand. So there's a lot of cigarette advertising and banners. This is kind of an informal snack shop, kind of bus stop. And this is sort of how it feels, especially it felt early on to go to Indonesia. You see tobacco kind of everywhere. You have the banners, you have billboards, you have music concert sponsorship, you have sponsorship of the soccer teams, and you even have college scholarships that are given out by tobacco companies. So a very strong tobacco presence, and honestly, right, some kind of alarming messages like the don't quit and the go ahead and smoke messages. So that's the backdrop. Looking at this 2018 tax, again, different countries have taken different approaches to e-cigarette use. And Indonesia initially was considering a complete ban in the same way as other countries have done, and they settled on a 57% tax. My understanding was that this was going to be a tax on the retail price of the e-liquid. So they weren't going to tax the devices, but just the e-liquid sales. And that would be an ad valorem tax, or a tax that would be based on the sales price. And this was announced, I think, in like mid-2018 and took effect October 1st, 2018. These taxes would exceed the average 40% tax on cigarettes. So again, this seemed like a great opportunity to go and see, what does this massive e-cigarette tax have as an effect on conventional cigarette use? That was our research question, and we decided to look at this with a pre-post survey. Again, looking at the sales data did not seem to be a very good approach, but if we looked at those individuals and we get their tobacco product use of e-cigarettes and conventional cigarettes at before the tax and then do it again after the tax, we could compare and see how the tax changed things. So we worked very quickly to get this project funded and all together and everything, and we did wave 1 in September, so about a month or so before the tax took effect, recruiting by Facebook and Instagram. I'll talk a little bit more about that. And then a month or two after the tax took effect, we did another follow-up survey with those same people, recontacting them by email and WhatsApp. For that recontacting, it worked out pretty well. That in wave 1, we told them, we're going to do another follow-up survey. What's the best email to reach you at? What's your WhatsApp number? For those who don't know WhatsApp, it's basically a messaging platform that's extremely popular in some countries, including Indonesia. And so for the wave 2, when we contacted people, we sent them an email saying, click this link to take our second survey. And we also at the same time sent them a WhatsApp message saying, go check your email, the survey's there. And I think we did about 4 rounds of those messages. So that worked out pretty well. The survey platform was Qualtrics. Many of you may know that as a simple way to do an online survey. We programmed it in the national Indonesian language. Indonesia actually has, I think, around 400 different languages, but the national language is, kind of the standard that we used. The inclusion criteria were being ages 18 or older, and then essentially being a dual user. So you had to definitely currently use e-cigarettes at least monthly, and you either had to be a current smoker or to have quit smoking within a year. We felt that, again, this population was the most likely to switch from one product to the other. We also did some qualitative work talking with vape shop managers and city officials and tax officials in Jakarta. So our formal hypotheses, right? So first one was that e-cigarette use would decrease from wave 1 to wave 2, that conventional cigarette use would increase from wave 1 to wave 2, and then that these would be correlated. So I thought it'd be useful to talk a little bit about how Facebook works with the online advertising. And this is a pretty remarkable tool when you think about it. You can sit here in the US, have a credit card, go online, design some ads quickly, and just launch them in a foreign country and get results within a few days. It's pretty impressive. It has a lot of features and a lot of tools involved. It probably changes quite frequently as to how that's all laid out and what that can do. And the first thing you do is decide your audience, then you can develop an ad and decide when to launch it and your budget and everything. One of the nice things about it is it shows, as you're typing in your demographics and who you want to target, it gives you an estimate as to what audience they think you'll get out of that, how many people may respond per day based on what you've put in so far. On the other hand, there's sort of a black box, an algorithm kind of element to it, right? They actually recommend that instead of paying per click or anything, that you just sort of give them money and they will give you results. They don't specify very clearly that ratio of how much each click works. And they don't tell you exactly where these ads are going to go. You can have some control over it, but we ended up picking a mix of Facebook, Instagram, and Facebook's ad partners, which is where they go and they put ads on websites or apps that they have connections with. So these are the 2 ads that we used. We used stock photography that we paid for pretty inexpensively. It shows some young Indonesians maybe like doing a survey. We have one of each gender. And we just basically said, do you vape? Take our short survey to get 50,000 rupiah phone credit if you meet the survey qualifications. So to just explain what that means, phone credits are a commonly used thing in Indonesia. They're a very easy way for us to pay people. We could do that through the internet and track that. And 50,000 rupiah is the equivalent of around, I think, about $3 or so. It's about a 15,000 to 1 ratio. So that was the advertisement we had on Facebook. This is the version I created for Instagram, very similar. And then there was a similar version that was used in the apps and the Facebook partners. So another thing about the Facebook advertising platform is you can get a tremendous amount of data from it. It's almost overwhelming in terms of how much is there and how much you can get out of it. This just shows some of the different ads we have and the reach they had and everything. But you can get it based on demographics of the users. You can set it up to explicitly compare one ad versus another. There's a lot of rich information there. And so these are some of our metrics for recruitment. According to Facebook, about 2 million people saw our ads. We spent about $2,700 on these. We got 36,000 people who clicked on the ads, and from them, 1,300 went on to be eligible and complete the first survey. When we did the recontacting again, through about 4 rounds of recontacting from email and WhatsApp, we got about an 80% response rate, which we were really happy with. In terms of how the algorithms allocated things, about 20% of people saw the ad on Facebook, 20% Instagram, and 60% on the partners platforms. And then in terms of devices people used to take our survey, 94% on Android, 6% on iPhone, and actually less than 1% used a desktop computer. One of the useful outcomes of this was seeing the price to recruit each participant, right? So we spent about $2 per person, which is really quite economical if you think about it, right? To get participants to do a survey. Again, this is the cost to recruit them, and we also paid them the incentive costs. And these are the demographics for participants that were in both waves, because again, this is a pre-post survey, right? So we're analyzing only the data of people that were in both of those waves. The median age was about 24, so fairly young group. And honestly, some of that may be the platforms, right, that were advertising on digital platforms. Like smoking, it was mostly a male activity. Mostly men took the survey. And I think that's mostly related to the e-cigarette use. Education and income were about what we expected. A fairly urban population, that's also part of how Indonesia is. And we were happy to see that we were able to reach 31 out of the 34 provinces. So we had a pretty good geographic distribution. So here's one of our first results tables. The first research question again was, or the first hypothesis, right, was that e-cigarette use would decline as the price went up. So looking here at this top table, you can see the percent of people who were daily users decreased from 76% to 64%, and the number of non-daily users increased, and some people quit using e-cigarettes. The use times per day was about static at around 3 or 4 times per day of using e-cigarettes. The number of days that people used out of the last 7 was a slight decrease from 5.7 to 5.4. And e-cigarette quit intentions increased a little bit. So in relation to our first hypothesis that e-cigarette use would decline, that seems supported by what we saw. And then in terms of cigarette use, we actually also saw somewhat of a decline. Daily use declined a little bit. Non-daily use was about static, and some people quit combustible cigarettes. Among the daily smokers, there was not a significant change in the cigarettes per day, but among the less frequent smokers, looking at cigarettes per week, there was a decrease. And quit intentions for cigarettes did not change. So in terms of our second hypothesis, where we thought that combustible cigarette use would increase, that was not really supported by the evidence here. And then we can go ahead and look at that correlation of the two and to see, are the same people that are changing the use of one product changing the use of the other product? And here we do see a significant correlation of a negative correlation, right? So as people are increasing use of one product, they're decreasing use of the other. But it was relatively small. And on this table here, right, we show the 9 different possible changes from wave 1 to wave 2, where you can increase use of one product or increase use of the other or decrease or whatever, the different scenarios. I highlighted here the one that we were sort of most interested in, right, which again is people that decrease the use of e-cigarettes and at the same time increase the use of combustible cigarettes. And so this was fairly low from a public health standpoint. That's certainly a great thing. Again, this is that red line, the thing we really don't want people to do, to go from a product that's maybe moderately harmful to a product that's extremely harmful. But it's also somewhat contrary to our hypothesis. We thought this would be maybe a higher number. And part of the reason for that we'll get into now. So we also asked about prices paid and the taxes and everything. We showed people a picture, as you can see on the right here, of this tax stamp. And we said, have you seen this on your recent purchase? In wave one, again, a month or so before the tax took effect, only 25% of people saw it, and around 3/4 saw it at wave two. So that actually indicates pretty good implementation. The tax stamp was pretty common after the law took effect. And looking at the prices paid, the most common size bottle for buying e-liquid in Indonesia is this 60 milliliters. It's about 2-ounce bottle. So people paid an average of $8.49 in wave one and $8.88. This is US dollars in wave two, a significant increase, but only about 5%. And so that was something we had some inkling about early on, that the taxes may not be as big as we thought, and I'll explain why in a moment. But when we look specifically right at people who had no tax stamp at wave one but did have it at wave two, we see a 9% increase. So a higher increase there, but again, nowhere near the 57% we were expecting initially. 79% of people said that they noticed the price change. We also asked a number of other questions. Overall, the surveys each had about 100 questions. We were able to ask things from a number of different perspectives. And we asked about the average e-liquid spending of the participants. They spent about $20 US per month on the e-liquid. As a rough equivalent, say a pack-a-day smoker in Indonesia might spend $40 to $60. But that spending on the e-liquid is only part of the picture, right? Because you're still buying devices and the different equipment for it. And so we asked a couple of different ways to see how they thought about the relative price of these two products. And people tended to say that they were about the same, that one was not much cheaper than the other for using them. We also asked about different behaviors they may have taken to reduce the impact of prices at wave one and wave two. So we asked people in the last 2 weeks, have you done any of the following behaviors to deal with the price of e-cigarette liquid? And about 2/3 of people had bought cheaper e-liquids. There's a lot of different prices. About 50% had bought larger bottles to be more economical. And actually in both waves, about half of people had, at least at some point in the last 2 weeks, used used combustible cigarettes instead of e-cigarettes to save money. So that's an important fact there, that regardless of, even if they're sort of priced almost the same, that some people are still using some conventional cigarettes because it's cheaper. And my guess is part of that is sort of the barrier to entry thing, right? Even if you already own e-cigarettes and e-liquid, maybe you don't have it with you, but buying conventional cigarettes is ubiquitous in Indonesia. They're very common to find. You can even buy them one at a time. So again, a pack is about $1 or $2, and you could buy individuals for maybe 5 or 10 cents. So I could see where, depending on where you are and what you're doing, and if you have limited financial resources, you might smoke combustible cigarettes sometimes to save money. So when we learned that the tax may not be as big as we expected, this was where we did some adapting. We thought, okay, we were hoping to see, for the scientific purposes, we were hoping to see a 57% tax and to see what effect that had. But we didn't see that, and we had indication early on that maybe that whole tax wouldn't be passed along. So we devised an experiment to say, well, hypothetically, what would you do if the tax was this high? And we tried to make this as rigorous as we could and ask the question as clearly as possible. So in wave two of the survey, we didn't do this at all in wave one, only in wave two, we asked people to imagine that there was a 25%, there were 4 conditions, right? So we asked about a 25% increase, 50%, 75%, and 100% increase in the price of their e-cigarette liquid. And we said, imagine that there was this price increase of, say, 25% for all e-liquid. For example, a bottle that used to cost 120,000 rupiah would now cost 150,000. How would that affect your vaping? So you can see here, we tried to be very clear about it. We tried to explain that, what that percent increase would mean in terms of dollar amounts. And then we offered them different choices to explain what they think they would do, between they would stop vaping, to vape much less, to vape the same, to vape more. Immediately following that question, we said, in that scenario, essentially, what would you do with your conventional cigarette use? If there was that price increase for e-liquids, how would that affect your use of conventional cigarettes? And we explicitly told them, assume there's no change in the price of combustible cigarettes. And then we asked how they would change their behavior there. So these were the results of the experiment. In some ways, they match what I would have predicted, but in some ways, they don't. For e-cigarette use, basically, once you start getting to, say, a 50% increase in e-cigarette liquid, People say they would definitely vape less, and a fair number of people would quit vaping. But interestingly, in that scenario, not a lot of people would smoke more cigarettes. They say that most of them tended to say that they would smoke less cigarettes and stop smoking. And so this is an interesting result that maybe suggests that the substitution effect is not that strong for these two products. And maybe one way to think about this is to think about how if people are switching or trying to switch from one product to the other, maybe they're doing that for philosophical, for health reasons, and they're pretty strongly committed to using the product that they want to use. And so maybe when they have less money, they'll just decrease use of both products, which is sort of what this is suggesting, rather than switching to the more harmful product more. So from a public health standpoint, this is relatively good news that that people's expectations or what they say they would do is that even if the price increased even if it doubled, people would only 3 to 6% of people would smoke more combustible cigarettes. So this was helpful and also kind of reassuring to see that these results line up in that people tend to say that they don't think these taxes would dramatically increase their use of combustible cigarettes. So, like I said, we talked to people, both shop owners in Jakarta, and we went to a vape fair I'll show you some pictures from. And we talked to some tax officials to understand, what were the plans for rolling out this tax policy? How was it going to be implemented? And this explains where we go from that supposed 57% to the actual, say, 9% that we ended up with. And it turns out that there were different government agencies involved. The one that passed the 57% tax was not the same one that implemented it. And the government agency that was implementing it decided to implement it somewhat akin to how they do conventional cigarettes. Conventional cigarette taxes in Indonesia are actually quite complicated. There's about 12 different tiers. They're simplifying it every year a little bit into fewer tiers. But right now, cigarettes in Indonesia are taxed based on how big of a company it is that's making the cigarettes, what kind of cigarettes they are, whether they're the Kretex or what they call white cigarettes, which is the cigarettes we're all used to in the US, and whether they're machine-made or hand-rolled. And a lot of that is designed to protect, say, small companies and hand-rolled processes. But the effect of it, of course, is that there's just a number of different tax classifications. So they sort of followed that same policy with e-cigarettes. What they decided was to have 4 different tiers of taxation based on the sort of expected final retail price of the product and this idea of different qualities of e-cigarette liquid. I'm not entirely clear how that's defined. It may simply be based on what the company's target final price is. So looking at the data we got from participants in Wave 2, most people were buying those 60 milliliter bottles, and the tax stamp on most of those was 40,000 rupiah. So when you do the math and you look at what the price would have been before that tax stamp, it shows that the effective tax rate for those bottles was around 42%, which still is quite substantial, right? And this is interesting, and this is one of the contrasts and one of the things we may not have expected from the beginning, because coming from the US experience, whenever tobacco companies are faced with a tax, they raise prices by that much and even more to make up for their lost sales. So in the US, if the price of a pack goes up by $1, tobacco companies would probably increase it to by $1.25. So they would do the tax and even more. In Indonesia, kind of the opposite happened. My guess is that the industry was partially afraid of having their prices just go way too high and losing a lot of users. So they just absorbed the tax at a lot of different levels, at the manufacturer level, at the retailer level. And again, that end result was only about a 10% increase. When we talked with shop owners, some of them explained kind of honestly that this was a fairly profitable business early on. There wasn't a lot of startup cost. You could go out and buy cases of this e-liquid, resell it, double or triple your money. It was a very profitable business. And so apparently there was enough profit in there that they could cut some of that out to keep their prices more stable. And my understanding is that that's what happened with this tax. Here's a few pictures of what vape shops look like in Jakarta. You can see this is a pretty modern one. And again, it's a pretty low cost to entry to work in this business. You, especially before there's taxes and everything, there's no real regulation of it. You just sort of set up a stand and buy some e-liquid and you can start selling. A lot of them were kind of smoky looking like that, and it kind of had a lounge hangout feel to them. Like I said, we also went to a vape fair. This felt kind of like a convention for vaping. This was in Jakarta, and different vendors had all their little stations set up where you could sample the different e-liquids, look at the different models of e-cigarettes. It was mostly attended by men, but there were some women there also. And people were just sort of hanging out, vaping, trying all the different things, talking about it. And it was also interesting that the tax officials set up a booth there to start talking about how the tax was going to happen. So we went to different vape shops in Jakarta, and we asked them to show us, what are your top 5 selling flavors? And we haven't looked at all this data yet, but one of the things we've tried to do is to compare the prices of those top 5 flavors before and after the tax. My guess is, again, they'll be around that 10% increase. But this just shows some of the popular kinds of flavors. That one on the left there, Banana-licious, I guess it is. Banana cream strawberry. That one has the tax stamp on it, you can see. And then you have these other flavors. Interestingly, in the US, if you were trying to classify e-cigarette flavors, maybe you would say, well, I guess we have the ones that are like tobacco, we have minty flavors, we have food flavors, we have candy flavors. For whatever reason, in Indonesia, the main classification is what they call either fruity flavors or creamy flavors. And maybe there's sort of an intersection there of this banana cream strawberry. I don't know how you would classify unicorn milk there, but again, kind of like vaping in the US, where there's just an incredible array of flavors. Some are described as food flavors, some are not. And kind of anybody can go forth and make their own. So I think it's important to be honest about some of the limitations of this study. One of the fundamental challenges, right, of a pre-post survey is that we can't control for external factors. It's possible media campaigns affected use of these products. And then there's sort of maybe the secular trend, let's say, of use of these products. So, right, ideally, if people are using e-cigarettes to quit combustible cigarettes, you would expect that combustible cigarette use to decline just sort of naturally, right? Because hopefully they're weaning themselves off of that harmful product. On the other hand, we do see, especially at least in the US data, we have less for Indonesia, but that a lot of people become dual users and then a year later switch back to just doing combustible cigarettes. Essentially, they tried the e-cigarettes, it wasn't working well for them, they switched back. So there are some trends that would naturally go on for use of these products. And so when we were designing our study, we had a time crunch, we had limitations in resources. We decided to go for it, but we also had hoped that because we were doing a fairly tight window of about 2 or 3 months, that there wouldn't be a lot of natural change in the use of these products. And so our thinking was that if we had a 3-month time period and a massive tax in between, that we would still see some effects. These top 2 sort of limitations suggest that in a future study in this direction, it would be good to have better controls. So ideally, for that first one, if you could figure out an equivalent environment to track at the same time, that would be useful. So for example, maybe if Malaysia had similar other external trends and you could track Indonesia and Malaysia at the same time, you could see the differences. In terms of the time frame, what maybe would have been ideal would be to have more time points where we could say, in a standard 3-month period where there's no changes in the taxation of these 2 products, how much does behavior change in Indonesia on these 2 products? And then we could subtract that out from our study and see how much was potentially due to the tax. We also might have seen a larger change in behavior if we had a larger time difference between the pre-survey, the tax implementation, and the post-survey. In our case, again, we wanted to make sure we got that pre-survey out there before this tax took effect. We didn't have a lot of time to be ahead of that. If we knew a year or 2 in advance when this tax was going to happen, it'd be great to do that first survey right away, get data a year out before people hear the news as much, before they start stockpiling, and then ideally also to look at the after effect, say, a few months after, and then maybe a year after the tax took effect to see, because, like I said, people could be stockpiling in advance, and then people could be using up some of that stockpile later. And so we'd maybe see more effect if we had, say, 4 different time points. So to summarize our main results here, as hypothesized, e-cigarette use declined in our study period. We also seem to see that cigarette use declined. We did see an association of the 2, that people that changed use of one product had an inverse relationship with the use of the other product. Some people did say that about half of people said that they sometimes smoke cigarettes instead of using e-cigarettes to save money. So that's an important thing to think about public health-wise. And then we did those hypothetical experiments showing that if we raised e-cigarette taxes significantly, people said that they would vape less. But there also wasn't a lot of people saying that they would increase the use of combustible cigarettes. So that's a good thing. And then in terms of discussion, one of the takeaways here is that implementation is not always the same as what's written in the law. This is a fundamental thing we've known for decades, that in the US, anywhere in the world, that what's written in law may not be exactly what happens at the final level on the street. And especially with these kinds of pricing things, there's a lot of different factors involved that can affect it. As in this case, right, we saw that one, a different agency implemented it versus the one that passed it. Two, they implemented it in a way that was not going to have that same 57% effect because they were using classifications and these set tax stamp amounts. And then third, that the company has absorbed a lot of the cost of that. Our study suggests that a 10% increase in e-cigarette price did not increase smoking in the short term, at least. It's not as clear what a larger tax would do. That said, it does seem prudent that whenever you're dealing with taxes, especially if you're talking about taxing a potentially lower risk product, that you should raise the taxes in both products. That's really what was sort of helpful about this whole project, is that the takeaway message is potentially very clear, is that you just say, if these products are substitutes, just raise the prices on both. We know raising prices on combustible cigarettes will decrease cigarette use, so there's really no harm in that. You bring in extra revenue. This supports raising taxes proportionally. And thinking back about that harm reduction curve, or the continuum of harm, there's actually been some good suggestions potentially about taxing products specifically based on how harmful they are. So maybe we should have much higher taxes on combustible cigarettes and much lower taxes on, say, smokeless tobacco and maybe e-cigarettes, and have no taxes at all on nicotine gum and nicotine patches. There were also some useful methodological lessons here. First of all, as with any international research, local knowledge can be essential. In this case, it happened a couple different ways. One, Elizabeth Orlan, a colleague of mine, had spent a lot of time in both countries and was very familiar in terms of helping us write the survey in the proper way and use the right terminology. We also had a researcher in country, Dean Anshari, who was at University of Indonesia, and he was actually a vapor himself, so he knew a lot about how to word questions, what kinds of products people were using. And then there's also the need to adapt to circumstances as they change. Again, this tax ended up being much smaller than we expected, but we came up with this hypothetical experiment that we were able to put into the survey and to try to get some more rich information out of. And third, one of the really exciting things for me was just that Facebook recruitment was quite possible, even internationally. The positive there, again, that it costs us about $2 per person. We were able to do that online pretty quickly. It would even help you, assemble the ads and put them in the platforms and everything. And we were able to reach a lot of people in a foreign country using Facebook pretty inexpensively. On the other hand, it is a black box. You think about like doing a literature review. Google Scholar is a fantastic resource, but you really can't use it in a literature review because you don't know what the algorithms are. And the day you do it, and 2 months later, maybe very different algorithms. And so it's a little bit, you have less control, you have less information about how they sort of do things behind the scenes. And so that's a trade-off. Obviously, in this case, it's not a representative sample. And for experiments and things, maybe that's fine. So we found that to be a really useful tool, and we're glad how quickly it worked. In wave one, we were able to, between launching the ads and getting all 1,300 participants, only took 5 days, which was pretty impressive. So for future directions, I'd be interested in trying to do the study in another setting. It could even be in the US, looking at different states where there's a high e-cigarette tax that's going to be implemented. Ideally, again, if we know it's actually going to be that high of a tax. And if we did it again, we would try to have more refined controls. So again, potentially either having a similar, jurisdiction. So if we're doing one state, having a control state, or having, say, 4 different time points. I think we could get more accurate data out of it. Because I do think this is really fundamentally an important research question, Do we accidentally or inadvertently start encouraging people the wrong way by taxing one product versus another? So I'd like to, again, thank my colleagues on this project. They really made this possible in such a short time period. Elizabeth Orlan at UNC, also my colleagues in School of Medicine, Sarah Coet, who did a lot of the analysis, Leah Randy and Adam Goldstein, who gave some good mentorship, and then Dina Anshari at University of Indonesia. Here's a picture of our sunny school in North Carolina, and that concludes my presentation. Thank you.
Thanks so much, Justin. That's super interesting. The framing of the e-liquid products, there wasn't a lot of discussion about closed systems. Can you describe the market? Is it drastically different in Indonesia, and I guess in the time period that you were doing this data collection, how companies like Juul might have played a role or not?
Yeah, and again, this is one of these contrasts of different environments, right? So, as we know in the US, right now, the vast majority of e-cigarettes are sold by tobacco companies or say Juul, which is partially a tobacco company. And a lot of them are closed systems, meaning that they have a cartridge that goes into the e-cigarette that you don't change the contents of. Indonesia is a different ballgame, especially when we were there. Again, the tobacco companies weren't involved. There wasn't like a major company that had the majority of all e-cigarette use. It was a lot of what they call the mods, and there were different versions of it. My understanding was that there was two ways these mod e-cigarette devices were used. One was you fill up a tank with your bottle of liquid, and another is that you actually drip the liquid on as you're using it. And some products were made to do both. So it was all very much a open system. We did ask in our survey about closed systems, and I think it was just a few percentage of people.
Can I ask you a question for the health economists that are here? Did you compute the price elasticity of demand for both products? Because you're hinting at it in your discussion, but somebody must. Do you have the data for that you could put up?
Yeah. So I'm not an economist by training. I know what elasticity is, and also involved here is cross-product elasticity. But I'd have to think about, and I'd have to talk to an economist, maybe yourself, to learn, can you do that when you just have data from prices people paid in shops and you don't have national sales data? If you could, I could try to calculate that and look at it. I think, honestly, right, the correlation of the product use between the two is sort of getting at that same idea of substitution and cross-product elasticity.
Okay, thank you.
Hi. Again, interesting approach using Facebook and Instagram. I know that it's a huge thing in Indonesia using social media. I'm curious whether the result of your study, did you report any of it to Indonesian officials, the tax people, the Ministry of Health perhaps? And if you did, what was sort of their response to this study?
Yeah. To be honest, that's a good point. We haven't thought a lot about with this particular project. With my thesis, I was really intentional early on to try to involve and report the results back immediately. We haven't done that yet with this project, but it would be great to try to circle back and get some perspective on it. In some ways, maybe what we found was somewhat obvious that the prices didn't change a lot on the street. But it would be great. Yeah, we should set up a meeting to talk with tax officials and see how they think about this.
Thank you.
And we are working on a fact sheet, which we will be
Absolutely.
sharing with our Indonesian partners. So as soon as that fact sheet is done, we'll be working with folks inside the country. Yeah.
So I know you already talked about how you only had these 2 time points, and the second one was pretty recently, or not recently, but it was pretty soon after the tax increase happened, and that the tax increase wasn't that much because retailers and manufacturers were kind of absorbing that increase. Would you expect over time that they would absorb less and less of that and kind of pass on more of the cost of that tax to consumers?
Yeah, it's an interesting question. Pricing strategy, around cigarettes in the U.S. is an amazingly complicated thing that we don't always take enough consideration within the public health world, right? Because they'll change prices by 3 cents on one brand and 2 cents on another and shift the different tiers and all that. What would I expect over time? I think if they could profitably sell liquids for more, they will. But I think they're probably trying to keep it fairly close to the conventional cigarette pricing. That's my guess. And also, it's going to depend a lot on probably also on consolidation, right? Because if you do have 1,000 different vendors making e-liquid, and all you need to do it is buy a couple bottles of flavoring and a couple bottles of propylene glycol and nicotine, and they're all doing it at the same time, I don't think there's going to be a massive uniform increase in price. But if we get consolidation, like I didn't answer Ryan's point about Juul. At the time we were there, Juul didn't have a presence. That kind of technology was just starting to get in. But Juul is looking at Indonesia, and suppose there is more consolidation, I would not be surprised if prices start increasing.
Thanks.
Thank you, Justin, for great presentation. I have a question about price increase scenario. When I check the table, especially for cigarette users are more sensitive to stop using cigarettes for price increase than electronic cigarette users. The percentage are very lower than compared to cigarette users. Do you have any idea why they are more sensitive, or electronic cigarette users are less sensitive than cigarette users to price increase?
Yeah, let me see if I can quickly go back to that.
Yes, the first row.
Is this a slide?
For example, 25% increase for electronic cigarette users. There is only 2% mentioned will stop vaping, but 30% mentioned stop smoking.
Yeah, so first of all, it's important to point out that these are actually the same people, right? Because everybody in the study is either a dual user or uses e-cigarettes now and recently quit combustible cigarettes. So these are the same people, but it is a fascinating result that, sort of if there's a price pressure in their situation of what they buy, if one product becomes more expensive and maybe the overall tobacco expenditure goes up, they're actually more likely to quit that combustible cigarettes, they seem to be saying. So my take on that, right, is that they're not going to change their ratio of products as much. They're still going to try to be using that healthier product, and they're just going to use less of both, or less of the more harmful product. So it's an interesting point and be worth looking into some more. Sorry, one question per person, sir.
My name is George, and in the North American market, tobacco-flavored e-cigarettes are everywhere. Did you ever see a Kretek-flavored e-cigarette? Is that, that's just something I don't think I've seen in Indonesia, but I'm curious in your field work if you ran across clove or similarly flavored e-liquids in Indonesia.
Yeah, great question. I mean, it's sort of one of the first things you would think about, right? And I didn't see it anywhere. The bottle that I bought as a sample to take home is labeled like root beer black currant or something. So, and there's the unicorn milk. So apparently, I don't know exactly how the clove thing is seen from an Indonesian perspective. If it's seen as like, this is just the way tobacco has always been, and we're used to it tasting and smelling like this. And when they switched over this new technology, they were like, why would we have to use that flavor anymore, or what? But it's a fascinating question in itself. It would be interesting, right, to compare, what % of US e-cigarette users use tobacco-flavored e-cigarette liquid. And it's not especially high, I think. I think it's pretty small. So I think, people are trying to get away from it, they're trying a new thing.
And it might be a generational thing as well. So the people who are using Kretex might be generational of what flavors people are looking for.
Mm-hmm. Yeah, maybe say the boomers would use more of the. Just kidding. Any other questions?
Well, that's fantastic, Justin. Thanks so much. This is such an important topic. I think a lot of people in thinking about how we should be taxing e-cigarettes in relation to cigarettes. Should it be higher, the same, lower, no tax? This is all theoretical, and it's great to have empirical work that can inform those discussions. So thanks for taking taking an opportunity to study this, like at the time, a before and after, and to help inform those discussions. So great talk. Thank you.
Thank you.